Good morning, America, and welcome to this morning's Going on Offense webinar. My name is Daryl Moon, and I'll be your host today. This is our 7th webinar in our new series on workplace mental health and well-being best practices. The sponsor of this series of webinars is a very uniquely proactive mental health and personalized well-being program called Resilience Pro. The pandemic has certainly upended the lives of most Americans and businesses in this country. And clearly, it's had a huge impact economically. These webinars have been conducted now for 7 months and have focused, and we've done more than 50 of them now, and we've focused on going on offense to address the impact of the pandemic, and the impact is having specifically on the emotional well-being of individuals and their mental health. The topic of today's webinar is how important it is to regularly monitor the well-being of your workforce. As I've mentioned before in these webinars, I have had the great privilege for the past 10 years of meeting with groups of CEOs around the country for often 3 to 4 hours at a time to discuss controlling healthcare costs and improving employee health. I love to ask a group of CEOs why they're willing to spend the second largest cost of running their business on healthcare benefits, and what do they want in return for their investment? I say, you're the customer. You're the one paying for it. What do you want? They usually look at me and say, you mean I have a say in it? That usually comes as a surprise. So I ask again, what do you want as the customer? You're the customer. They always say the following 4 things, and usually in this same order. Well, number 1, I want to attract and retain good employees. Number 2, I want a healthy, productive workforce because my product that goes out the door is directly tied to the health and productivity of my workforce. Number 3, I want my employees to be satisfied with the healthcare system. And number 4, I don't want it to cost so much. So I then ask them, well, how many of you are monitoring those 4 things? Like you just said, you do that with other aspects of your business. Are you monitoring whether you're getting the 4 things you want? And they say, well, I monitor the cost every year, but that's all. So I point out that they should be monitoring all 4 things. And most importantly, they should be incenting everyone in the system to give them what they want. From their own HR team, to their insurance broker or benefit consultants, to the insurance plans, and the providers of healthcare. They should all be aligned with the customer to give them what they want. They should monitor and be able to say, look, you're getting it, or you're not getting it. Here's incentives for getting it. One of the biggest problems in our current healthcare system is that everyone is perversely incented not to give the employer, the customer, what they want. In a fee-for-service industry, the more people that get sick and the more services that they can provide, the more money the system makes. And I know that firsthand, having been the administrator or assistant administrator or CFO controller of 10 different hospitals across the country. The most successful healthcare systems in the world focus on improving the health and well-being of their members, not just fixing a problem when it happens. We call this aspirational healthcare versus deficit-based healthcare. Don't just fix a problem or treat a disease, focus on preventing it in the first place. They have proven, those systems that are the best systems in the world, they've proven that healthcare costs can be significantly less and is far better quality when this is the focus. So today we're going to talk about how and what the reasons are for monitoring the well-being of workforces and the various ways that we can do that. I'm honored to have as my guest panelist today, Bill Anderson with Redirect Connect. He is one of the few benefit consultants in the country who understands how important it is to monitor well-being and to actually build those monitors into each of his contracts and is willing to be held accountable to see that health improves. Bill, would you take a couple minutes to introduce yourself?
Sure. It's great to be here. Thanks, Daryl. I love these sessions that you do, and I think that as we've done them over these past 7 months, and I know you've invited me previously to be a guest panelist, but I've listened in to many of them, and I just really appreciate the opportunity. This, I think, is a really awesome experience for brokers, for employers, for vendors, for anybody that desires to really truly make a difference. So, yeah, I come from this industry. You know, we've been friends a long time. I've been in the industry about 35 years now, as a broker initially, designing self-funded and partial self-funded health plans. I've been a co-owner of a TPA. I've been a co-owner of a couple of reinsurance carriers, worked on the wellness side, even had a period of time where we were completely focused on wellness and prevention, and owned a nutritional company where we designed specific products for doctors. And, you know, I've really tried to influence the industry in lots of different ways. Finally, as I've gotten older and gotten away from a little bit of the, you know, traveling all over the country every day, settled in to work with Redirect Healthcare. Fell in love with what they were doing. They've been around about 17 years now. And to your point, you know, there's lots of great companies and great organizations that take a claim, manage it through its process well, pay it, make sure the vendor gets compensated, make sure the plan gets billed appropriately, and life goes on. But there's way more to that process, and I'm talking about even way beyond negotiating appropriate contracts with providers that may be done by the Blues or United or Aetna or whoever, or even independent contracts that are done. There's way more to it than that, and or monitoring somebody that's already got cancer or somebody that's already got diabetes, and making sure that they get the best pricing for that. We live in a day when many organizations, as you and I know, whether it's a hospital or clinic or whoever, are all looking at their own business strategies and trying to create as much profit as they can and balance that with affordable health care. And that doesn't work very well. The incentives are incorrect. You know, employers, as you mentioned, are looking for how do we provide really awesome healthcare and make it really affordable. And what we're seeing today is I take calls from brokers every day now, and employers every day. In fact, often more, we get the call from the employer who says, I can't handle this anymore. I can't handle the increase that I'm seeing. And my broker's a really good guy. I like him or I like her, but they're not bringing me solutions. My interaction with them has become transactional, and I can't do transactional anymore. I need something that really is going to move the meter. So you and I know, and I know there's some of us out there that are really looking at this more from a clinical perspective. It's awesome that you can pay a claim, but so what if you pay for John's lab test and you determine that he needs to have his colonoscopy and and you look at his BMI, or you look at his initial markers and he's got some weight issues or diabetes, or congratulations if you pay the claim on the physical, the blood analysis and everything else. But if you're not helping John Doe move that meter and helping him improve and change from A to B or Z and move him all the way through the pathway, really looking at that clinical information of what's going to move those markers for John, what's going to help him make a behavioral change to spend his healthcare dollar differently, and what is the right use of the healthcare dollar. Where does that concierge process take over in helping that customer? That is the key. That's what Redirect does. Redirect wouldn't even exist. Redirect Healthcare wouldn't even exist if it wasn't doing that. So in so doing, they have proved over these years that the ability to reduce costs is really significant. I know people laugh at this a lot, particularly if they've been around the industry for a long time, and I know you and I have talked about it. Redirect Healthcare is one of those companies that, you know, if we look at the average cost of healthcare for an employee and we average it out for the year, it's, you know, somewhere in the neighborhood of $10,000 to $11,000 per head, and that's being conservative. I've seen ones that are far higher than that as well. Redirect is far below $5,000 a head, that's not by accident.
And the reason is because the focus is on the health of the person.
It is
not the processing of a transaction.
Yeah, I mean, and in stealing one of your favorite lines, which I still think is one of the great things that you say, and it's a great metaphor, is that most of the healthcare system is standing at the bottom of the cliff, watching and coaching people to jump off, and then as they bounce and break, they go fix them. And I can relate to this. I grew up in a home where my mother had 17 major operations. By the time I was a senior in high school, she's had 70 total, more than 70 in her lifetime. She's in her 80s and has 5 different diseases and everything wrong. I've watched mom bounce. I've watched the systems put her back together. I am in love with our medical system that saves lives. What I've always been frustrated about is, can't we find a way to help mom not jump? How do we help her not fall off that cliff? Or even maybe she didn't jump, maybe she just fell off and she didn't know what else to do. I love the metaphor of how do we stand at the top of the cliff and make changes? How do we help people see the difference? And that's what you and I are in the business of. That's where I come from.
And having been a hospital minister, I don't know that we coach people to fall off the cliff. It's not like we're asking people to jump or to fall, but we're certainly not putting fences at the top of the cliff to prevent them from falling. And
Yeah,
that's the problem. It's all about where do you park the ambulance at the bottom of the cliff?
Yeah, I think you're way nicer than me. You've always been more diplomatic. I know there are providers that stand at the bottom and say, hey, wow, let me help you jump so I can do a surgery. And I'm not trying to pick on providers. It's just that their business, if I go to doctor school and I become the best at doing X, that surgery specifically or this surgery specifically, that's what I do. I want to do as many of those surgeries as I possibly can. So I'm going to get good at finding everybody who needs me. If I'm a really good marketer, no disrespect to them, if I'm a really good marketer, I'm going to find a way to sell as much of that as I can. And I think that our industry today has become way too financial centric or focused on outcome from a perspective of fix me. Yeah. versus prevent this.
Which is what really today's topic is how do we monitor health at the beginning instead of just how are we doing at fixing people once they fall off the cliff?
Right.
So let's talk about that for just a minute. And before I ask you this question, let me just ask and encourage our attendees today to send in their own questions. We would love to address your questions. So use the control box, use the question, and just simply send in those questions. So let's start with, in your opinion, what are the various reasons why an employer should be monitoring the health and well-being of their workforce? What are some of the reasons that come to your mind?
Well, this has always been a fine line, and there's a little bit of energy that some employers have if I'm dabbling too far into my employee's space. And I want to make sure I'm within HIPAA compliance and all of these fun things, and I can't hire or terminate based on medical conditions. So there's always that little fine line that they're living with. And so I think that there's a little bit of scariness that some of them have, but the real truth is that the reasons they should be doing it is they're really producing, if they're producing happy, healthy, productive people from a workplace environment, that's rolling over into the homes, it's rolling over into the marriages, it's rolling over into lots of categories, not to mention the fact that it's saving health costs.
But most importantly, it's rolling over into a better quality product for their customers.
Exactly. So I think that introducing initiatives that create every opportunity for an employee to make a change on their own. And I, listen, you know how I feel about this. I believe that at some level, the reason that we're here is to provide truths and opportunities to help people make choices on their own, to blast themselves out of their predictable future. We know where they're going to head. We're data people, right? We know where they're going to head if we don't give them a choice to blast themselves out of their predictable future. So how do we do that? And I know that we have lots of initiatives that we talk about and we do and we implement, and they work. Every day they work. And I know we're going to talk about some of those. So, but I think that it matters because at the end of the day, employers can't continue to have this upwardly spiraling health plan cost. It just doesn't work.
Right. Well, and a few weeks ago, we had Dr. Andy Crichton on as one of our guest panelists. He was the medical director, chief medical officer for Prudential Financial for 20 years. And I think he's one of the very best examples out there of a very large company who said, if we weren't offering healthcare services, if we weren't buying healthcare in forms of insurance, and we didn't have to worry about that. Would we care about the health of our workforce, and what would we do with that? And they decided as a company to step back and go, you know what, we would care. And you know what, we ought to be monitoring it. And they're one of the great examples in this country where they actually implemented on a regular basis monitoring in 4 or 5 major categories of health and well-being, how their employees were doing. And because they were monitoring it, they used those monitors to identify areas where there were needs. And they implemented year after year various strategies to address whether it was emotional needs that were being identified, spiritual needs, physical, nutritional, environmental, intellectual. It didn't matter. The fact that they were monitoring it gave them information to know what kinds of resources their employees needed. I think it's a great example of a large company who took a very proactive approach to finding where the needs were and then addressing those and putting interventions in place to address those.
Yeah, I agree. I know one of the programs that we run at Redirect, you know, we really focus on the management of the electronic medical record. So we have a team that if we know somebody's taking a prescription drug, if we know that they're a diabetic, if we know, and we've determined this through our, you know, looking at their charts and helping them create a virtual chart, for lack of a better description, with our organization. And we navigate with them. We help them prepare and process. I mean, if we know that little Johnny's got an asthma problem, we're going to make sure that mom has an asthma inhaler, dad's got one, maybe Johnny has one that goes with him to school. You know, no, we're not going to be worried. We're going to make sure that those are all ready to go and refilled and early, you know, before they run out, so that we don't have Johnny end up in an emergency room. But it's that proactivity, but it's also that extends to the proactivity of somebody calls into our virtual system and they're sick, or maybe they've got what they think is a broken wrist, and they are doing a virtual analysis. We find out that it's not really a broken wrist. You slipped and fell while you were you know, playing golf, and it looks like it's really just a bad sprain, but we don't know that for sure. We're going to do a watch and wait method. We'll call you back in a few hours, follow this procedure. We find out in a couple of hours when we call them back. And this is an interesting perspective. How many insurance companies, if you were to call in on the telemedicine or virtual call, are going to call you back and follow up with you? If you were the one, Daryl, who fell down, hurt your wrist, you thought you broke it, but you didn't know, you're being coached to navigate the process from home initially, so you don't have to go down and spend $1,500 at an emergency room trying to figure out the same thing. Oh, you just have a sprain. You know what I mean? So we contact them, call them back, and that active care matters. So to your point, you talked about a big analysis for the company where they're looking at all of those different things. We're just one component of that in the medical side. But what we do really well. But that is a critical factor for us, is that really proactive process, calling the pregnant mom, calling the person who just came out of surgery, just had their kidney removed, and doing a follow-up the next day, contacting them, and then a couple of days later, how's the swelling going? How's your pain? How's your da-da-da-da? And following that through all matters to keep the individual from the larger expenditures going forward.
Well, and I just want to point out that I really think that organizations like your Redirect Healthcare and the NUCA system of care up in Alaska both have proven over many years that healthcare can cost half or less than half than it currently does by simply focusing on health and the clinical and improving health and improving the well-being. It's about not waiting and reacting to someone falling off the cliff. It's like, it's not only good for the employee and the patient to help them prevent the fall, but it's good for the cost of the program. Healthcare doesn't have to cost $10,000 per employee per year. In fact, we should be seeing decreases every year until we get down to 4,000 or 5,000, because
right.
We've proven that when you focus on prevention and you focus on the clinical, the health of the worker, rather than the system paying for treatment, it's significantly less. If all you do is focus on the treatment and all you do is focus on the transaction of the treatment, you're never going to reach $4,000 to $5,000 per employee. You're just not. It's impossible.
Yeah, you know, it's interesting. Over the last couple of weeks, I've been on calls with, you know, we're doing business all over the country, and I've been on calls with employers in Massachusetts, in Ohio, in Nebraska, in Florida, in the Carolinas. And while it's a little different, the costs are a little different in some of those areas. The problem's very similar. We have lots of employers that are really struggling with COVID. They've got furloughed employees. What do we do with them? How do we continue to help them to navigate the emotional trauma of not being able to make money? We've got to keep them on our health plans. We've got to do all of these kinds of things. We've been able to implement a program just through our direct primary care that just focuses on making sure that they're getting a wellness visit, a doctor's office opportunity. They're making sure that they get their pharmaceuticals that they need, chiropractic visits. In fact, it's really interesting. The chiropractic load has increased significantly because there's so much stress. You know, you get all that stress, you get out of alignment, you get, you know, and it all of those things, as you know, we cover at 100%. There's no deductible, there's no co-insurance. It's that we know that those front end services really matter to an individual, and if you can take care of the basic needs of individuals, it makes a huge difference to our work population.
We've often mentioned, as we've talked together, about the fact that the current healthcare system is like driving a car on 4 blown out tires. And perhaps the most important one is that the primary care system in this country is badly broken. We have to make it a far more comprehensive, far more relationship, far more intensive, and actually quarterback the care of patients instead of just sending them off to a specialist or sending them off with a prescription. We don't do that very well. And of course, the others are helping people change behavior, addressing mental health, and helping people navigate this very complicated system. So that's what the best systems are doing to drive down the cost, not just simply saying, how do we work on the transaction? So let's talk just a little bit, since we're only have a few minutes left, about what are the ways employers are measuring and monitoring well-being. You know, some that come to my mind are a lot of companies use biometrics on an annual basis, and they're not very good at engaging people in change, but they're a wonderful way to monitor, are my employees getting healthier? You know, am I actually monitoring and measuring whether BMI is going in the right direction or going in the wrong direction? Cholesterol ratio and glucose and blood pressure, and these different monitors are, it's more of a monitor to see whether what we're doing to intervene is actually working than it is as an independent solution to try to drive change, because it's not very effective. There may be a few people, because they had a biometric screening, that will actually go out and do something about it, but it's a wonderful way to monitor.
Yeah, and I think all of those things you mentioned matter. You know, there's new technologies that are out there. I mean, DNA testing, a quick DNA test, a buccal swab that tells me where I'm deficient nutritionally, what I need, what sorts of things I need to make a difference in my life. The MCG testing to do an analysis on my cardiovascular system. There's all kinds of monitors, all the ones that you mentioned, and an employer, you know, a lot of employers think they get that with their wellness plan, or that perceived wellness plan inside of their fully insured product. And I'm not trying to beat up anybody, the Blues or United or Aetna, but if I'm buying a wellness plan or a perceived wellness plan, or I have an office visit that covers those things, just because I cover it doesn't mean I'm monitoring it. Doesn't mean I'm doing something with it. Your point, the word monitoring is a critical factor, and I kudos to Resilience Pro, and I don't know how much you're going to talk about that, but the Resilience Pro company has a monitoring system that allows an employer to look at the aggregate information of their group as people are answering questions and people are going through these analysis. I think most people today really want to know what's going on behind the Wizard of Oz's cape. You know, what's going on in here, so that I know what's happening with my body. I want to know how my cardiovascular system is doing. I want to know how my glucose is. I want to know, hey, I want to know, you know, there's a zillion vitamins out there. I want to know from my DNA, what should I be taking? I can't hide from my DNA any more than I can hide from my blood. I'm tired of going down to XYZ nutritional place and walking through there with 9,000 things I get to choose from. And my mom told me vitamin C was good, so I'll start there, but I don't really know, what I should do. And so I think that all of these monitoring devices, all these monitoring opportunities they work really well. We've used them a lot. I know you do. And I think employers, if they knew really what the monitoring solution was, they would spend more time on it.
Well, I think you bring up a good point. The individual, I as a person, I want to know if I have a heart problem. So the fact that I had an MCG, which didn't cost me very much, and I didn't have to go stand on a treadmill, I didn't have to go into a cath lab, I now know what my heart health is, and I can start to reverse some conditions based on some risks that were identified by that. And like you said, sometimes it's more important to monitor people's well-being on a cadence and like a pulse survey, where on a regular basis, you're just having people track how they're doing so that they can go back and say, gee, how have I been doing over the last 6 months or over the last 3 months? It also allows for the healthcare system to be proactive when people are struggling as they're monitoring and answering those quick, easy questions on a regular basis. It allows the healthcare system to intervene and proactively say, hey, don't fall off the cliff. Let us help you. Let's show some compassion and help you deal with that stress or anxiety or depression, or deal with other things that are starting to affect your overall health. So I think all of those are great examples, and even health risk appraisals. We've been using those for 30 years in the industry, but again, a way to self-report on how people are doing. All of those aren't necessarily wonderful ways to engage change, but they're wonderful ways to monitor that might then incite change. And particularly from an employer or a healthcare system, by monitoring it, you can proactively intervene and to support. Would you say that employees in general appreciate knowing that their employer cares about their health? And of course, we want it to be confidential. We don't want the employer to know anything about me personally. But the fact that, and you and I have talked before, even Dr. Crichton spoke with us about, the idea of sharing those monitors with the whole population. Let the whole workforce know how, as a group or as an aggregate, how are we doing? Are we improving? Are we getting worse? How can we bond together and as peers support each other in showing that as an organization, or even broken down by department, are we getting better? And how are we doing?
Yeah, I mean, this is an absolute yes. The employees, they changed. For a long time, they said, gosh, I wish they would do it. In today's world, they say, I expect it. And if we were sitting with a whole group, if we just had a library or something where employees came from everywhere and they talked about all the kinds of things and the decisions they made about going to work for XYZ company, I guarantee you health benefits and the expectations of what is in them are on their first 3 bullet points, maybe even their first bullet point. They're not as worried about, pay is pretty traditional. I could work for one company versus another, unless I'm a high level executive that's negotiating my own unique package. Payroll's pretty much the same. A lot of things are pretty much the same. Work hours are pretty much the same. You can't really change where you live. If you live in Ohio versus Nebraska versus Utah, if you're not going to move, you're still going to have similarities. But when you start talking about health plans and you start talking about expectations, the world is changing fast, and they expect to have high performing plans. Straight up, they just do.
Well, we're about out of time. Is there any last minute 20 seconds you want to share with the group before we close up today's webinar?
I would just say kudos to you for, if you're coming into a conversation like this, you're an aggressive thinker. We would love to interact with you. I know, Daryl, your company is an extraordinary company at doing what you do. We're trying to make a difference, and it takes all of us. For those of you listening, you're obviously professionals at what you do. You're probably really awesome at what you do. I would just encourage you that the more of us that work together as an awesome team, we can make a difference in healthcare. Healthcare is broken, but it takes people to do something that are opinion leaders, that have big voices, that have strong desires to make a difference. We don't accomplish anything going back into our tunnel or in our small space and maybe doing a little bit. That matters, but if we're gonna make a real difference, we need to collaborate together better. So I would encourage collaboration is a key to making change in a big way.
Great. Thank you, Bill. Appreciate that. So let's now wrap up and just mention that again, Resilience Pro is the sponsor of this series of webinars, and a brochure describing the solution is available for you to download through your control box. I will also mention that Resilience Pro offers a package of electronic technology that allows employers at no cost to actually implement some of these monitors we've been talking about, where you can track whether or not your benefits are attracting and retaining your good employees, whether or not their employees are satisfied with the healthcare system, monitor the health and well-being of your workforce. It's a wonderful tool that we're encouraging companies across the country to implement, even at no cost. Just start asking the questions and monitoring and prompting to find out where people are. Our next webinar will be on Wednesday, December 2nd. Join us as we discuss assessing mental health needs. Please join us on Wednesday, December 2nd at 9:00 a.m. Mountain Standard Time. As a reminder, the recordings of all of these webinars can be found on goingonoffense.com. We'll be putting this one on that probably by the end of the day today. The website also contains a host of ideas, suggestions, resources, and helps for organizations that want to provide emotional well-being support to their employees during these difficult times. We suggest you check it out. Have a wonderful day. Thanks again, Bill.